This feature is brought to you by JPHMP Direct, the companion site of the Journal of Public Health Management and Practice. With a 200% increase in the rate of opioid-involved deaths since 2000, many U.S. states and the federal government have declared states of public health emergency. In response, many state and local health departments are developing opioid data dashboards with visualizations, descriptive information, and downloadable data or reports. Opioid data dashboards can potentially improve our understanding of the opioid epidemic, facilitate community planning, promote evidence-based decision-making, and support monitoring and evaluation. Yet, will these data dashboards meet these goals? Most public health surveillance resources are devoted to collecting and using data for analysis rather than for communication or orienting communities toward action. As health agencies develop opioid data dashboards, we offer 10 recommendations for improving data-driven communication about the opioid epidemic. Number 1. Use available data rather than waiting for that ideal data set. Perfect data do not exist. Death certificates, hospital discharge data, medical records, and other sources can provide useful information on opioid trends. However, all of these data have flaws such as incomplete coverage, missing information, time lags, or biased reporting. But don't despair. Imperfect data are still useful as long as you make it clear what they mean. New York publishes quarterly county reports of opioid-related deaths, emergency department visits, hospitalizations, treatment admissions, and naloxone administrations based on provisional data through the preceding quarter. These numbers may change as the data become more complete, so reports explain how these data are collected and how to interpret them. Number 2. When data do not exist, turn to others facing a similar challenge. A local health department might simply lack data on opioid overdose outcomes that can help make a persuasive case for action. In these instances, find other local communities with similar profiles that have seen success with public health-oriented solutions. Share their outcomes to support your proposed approach. Number 3. Create data stories, not just data visualizations. The data visualization field has evolved from creating visualizations to telling stories. John Snow's famous map of the London cholera epidemic inspired new ways of showing complex information in visual formats. While current visualizations can help readers understand trends, they would be more powerful if they were presented as a persuasive story. The California Healthcare Foundation funded Live Stories, a data storytelling startup, to work with county-level opioid coalitions to create dashboards. The dashboard templates provided local-level data and encouraged coalitions to add personal stories about affected individuals to make the data more memorable. Number 4. Appeal to both the heart and the head. Data represent facts, and researchers are trained to search for truth. Yet persuading communities to take action may also require tugging at the heartstrings, which the Sonoma County Department of Health Services sought to do in its Farm Worker Health Survey. The report incorporated personal photos alongside objective data and charts to make a persuasive case. Number 5. Enlist writers, designers, and community members when crafting a story. Most data scientists are not data communicators. In the Sonoma County Farm Worker Survey, epidemiologists collaborated with the health department's communications staff. In a different example, a digital agency and communication firm collaborated on a report about the number and demographic characteristics of shift workers and their financial, health, and other daily challenges. They presented information in a story with quotes and videos to help readers understand the experience of irregular and unpredictable work schedules. Number 6. Don't start with the full story. Presenting detailed tables and complex charts is a quick death for communicating stories to broader audiences. Instead, start with a catchy visualization to draw in your readers. The California Opioid Coalition dashboards included teasers to set the stage. Monterey County's teaser was a bold statement that, quote, prescription opioids now kill more people than firearm homicides, end quote, with a line graph. This was followed by a question, quote, how many people died from prescription opioid overdoses in your county, end quote. The page subsequently scrolls to a map of California counties and hyperlinks to counties' opioid report cards. Number 7. Make large numbers relatable. The Centers for Disease Control and Prevention's Opioids landing page starts with a striking statement. Almost 218,000 Americans died from overdoses related to prescription opioids from 1999 to 2017. But are 218,000 deaths large or small? Large numbers are hard to grasp. We like the Washington Post illustration of the number of individuals killed by mass shootings. They provide a visualization of over 1,000 silhouettes representing each victim. Users can click silhouettes for further information about each shooting. Similar visualizations provide information and context for the 309 guns, 166 shooters, and 162 shootings. Number 8. Always talk to end users. A major challenge for health department staff preparing data products is uncertainty about their end users, what they want to do with the data, and their data skills. Understanding data consumers can help health agencies more successfully package the material. When developing its Prevention Agenda Dashboard, the New York State Department of Health solicited extensive input from local planning groups. While researchers typically want raw data files, some clients prefer data products in the form of 2-page printable handouts or PowerPoint presentations. Consult your end users throughout the process, particularly in early planning stages. Number 9. Involve local data ambassadors in dissemination. We are all part of a data ecosystem comprising data producers, data consumers, data stewards, and data publishers. Leverage your network to facilitate dissemination. For example, Health Data Matters, a Case Western Reserve Medical School initiative to improve community health in Cleveland and Cuyahoga County, actively involves community partners from more than a dozen local organizations to help formulate messaging, provide input on data, and encourage use of published information. Number 10. Don't forget to make data fun. Although the opioid epidemic's death toll is sobering, data communication does not need to be tedious. The Shift Workers visualization has a Schedule Invaders interactive game to engage readers while educating them on the challenges faced by shift workers. We also like the New York Times You Draw It game for readers to guess the trajectory of opioid overdose deaths. The first game is to guess how the trend of car accident fatalities changed after the 1980s. After revealing the answer, subsequent narratives describe the effects of car and road safety, recessions, and distracted driving. The next games are to guess the trajectory of deaths attributable to guns and HIV. The last game is for guessing the trend for opioid overdoses. This analysis is not sophisticated, but similar to classroom games, allowing readers to manipulate the graphs makes the content on opioid overdose trends more likely to stick and fosters curiosity about the causal explanations. And now it's your turn. While it may not be easy to apply all these lessons to your opioid overdose data, most of these lessons are entirely doable. They simply take enthusiasm, practice, and testing different ways to summarize information. Take advantage of data visualization tools such as Data Wrapper, Infogram, and Live Stories that are easy to learn and inexpensive. With practice and leveraging a data storytelling tool, you can readily apply some of these lessons to improve your communication about opioid overdose in your community. This feature has been brought to you by JPHMP Direct, the companion site of the Journal of Public Health Management and Practice. To learn more about the research presented in this video, read Visualizing the Opioid Epidemic, Lessons Learned from a Dozen Years of Engaging Communities with Data by Andy Krackov and Erika G. Martin, a commentary in the Journal of Public Health Management and Practice. For more information, visit us online at journals.lww.com/JPHMP.